Hi, this is Vaibhav Vaidya with the Fits on the Go blog here at ACC 16 in Chicago. We're joined today by Dr. Witte from Leeds University in England, and he's going to talk to us about his late-breaking clinical trial. Thanks for joining us, Dr. Witte.
Pleasure to be here.
Could you tell us a little bit more about the background, the aims and objectives of your late-breaking clinical trial?
So it became clear to us in our heart failure clinic that our patients were very frequently deficient in vitamin D. In fact, around 90 to 95% of patients with heart failure in the UK were deficient in vitamin D. We also had some suggestions that the degree of deficiency was related to the severity of the heart failure. And we also found in a simple observational analysis that new patients presenting for the first time with their heart failure had a greater response to optimize medical and device therapy if they were not deficient in vitamin D. All of these points led us to think, well, maybe we should think about a randomized placebo-controlled trial. We went forward with a proof of concept study in 53 patients and had a complete data set on 48, demonstrating the safety and biochemical efficacy of our supplement, and also some encouraging results on cardiac structure and function. And we then used all of these data to apply for a larger grant from the Medical Research Council to explore 12 months of 100 micrograms of vitamin D3 supplementation versus placebo in patients with left ventricular systolic dysfunction and heart failure symptoms.
Wonderful. That's an excellent hypothesis. And what were the results of your study?
We found that vitamin D3 supplementation at this level is safe. There was no adverse effect on creatinine or calcium. It reliably replenishes serum vitamin D levels, along with 125, which is the active agent, and lowers parathyroid hormone levels. So it's safe and biochemically efficacious. We also found quite dramatic improvements in cardiac structure and function, with a mean improvement in left ventricular ejection fraction of 6%, and reductions in left ventricular volumes and dimensions, akin to the levels that one might see with standard aggressive medical therapy from 20 years ago.
Those are really very intriguing results. What is your hypothesis for vitamin D in improving left ventricular function structure?
It's interesting. When we first went for the grant, I had included various mechanistic features in it, and all of the grant-giving bodies said, well, come back to us and show us it works, and then we'll go forward with a mechanistic study. It is likely to be related to calcium loading and calcium flux in myocytes, cardiomyocytes, but of course vitamin D has hugely important other effects throughout the body, many of which are underappreciated, but almost all of which could form or contribute to the initiation and maintenance of the heart failure syndrome. So immune function, arterial vasorelaxation, and parathyroid hormone lowering could all have an effect in the heart failure syndrome.
Wonderful. This is a great project, and I'm sure we'll all be checking our vitamin D levels in heart failure patients after this one. Thank you for joining us for this interview, Dr. Witte.
Privilege and
we
pleasure.
Appreciate it.
Thank you for having me.